Are you on? Oh, you're on mute. Oh. Oh, Brenden, I think you're on mute. There we go.
Yes, I'm sorry. Hello, everybody. We're already off to a great start with some technical difficulties. Wonderful. I'm going to get the slideshow going. All right. How am I? Can everybody hear me now? Good? Probably good? All right. We'll get started. Thank you, everybody, for attending our virtual session today. We're very pleased to be able to connect with you and share some of the information and background on the development of this resource. My name is Brenden Harvey. I'm a social research policy analyst working for Calgary Neighbourhoods at the City of Calgary. I've been working for the city for just over 5 years now, and I was responsible for the research that went into creating this document. This project was a really great opportunity for me because I've not really had a chance to work much with FCSS funded organizations or information, so I got to learn a lot about the kinds of work and services that they provide to Calgarians and Albertans. So I'd now like to pass the mic on to my colleague, Cynthia Okafor. Cynthia?
Hi, everyone. So Cynthia Okafor, and I'm a partnership specialist also with Calgary Neighbourhoods with the City of Calgary. And I've been with the corporation for 15 years now. I've had the privilege of working with FCSS-funded organizations over the years, and I'm truly grateful for the work that many of you do to provide programs and services and promote the well-being of Albertans. So with that said, I would like to take the time and acknowledge the traditional lands and territories in which we gather this morning. So this includes the many First Nations, Métis, and Inuit communities in Treaty 6, Treaty 7, and Treaty 8. We continue to honor the people, the histories, and the experiences of all those who resided here before us.
So here's the agenda for our presentation today. We've done the welcome. We're going to talk about the purpose of the session and what we're going to try and get out of it today. We're going to then go over some best practices for organizational concerns, technology best practices, and then we're going to break out into discussing some different kinds of virtual service delivery. We're going to talk about virtual counseling services, virtual mental health services, and virtual health, general health services. We're then going to talk about some other considerations that we need to keep in mind when we're delivering service virtually, such as age, gender, and language. And then we're going to have some time for questions and answers, and you can put your questions into the chat box, and we have a couple that were submitted before the session that we're going to address. All right, so purpose of the session today. First, I'd like to start off by just saying that it's really important to acknowledge the tremendous strength and resiliency shown by organizations operating and providing services in Alberta during these difficult and uncertain times. We're now over a year into the pandemic, and this has been an unprecedented challenge for the world. It's strained resources and systems to the breaking point, and we've all had to adapt our home and work lives to make it through this new reality.
So in order to continue providing services to citizens and vulnerable populations, many agencies and organizations have had to switch to different forms of virtual service delivery. So as you all know, moving from providing service in person to providing these services virtually, it's been difficult and sort of presents new challenges for organizations and, of course, opportunities that we can all look forward to as well. Now, the purpose of this session is to provide agencies and organizations operating in Alberta with information on the best practices for virtual service delivery. So we want to look at how different kinds of services can be provided effectively to clients in a virtual environment. So how we can capitalize on the benefits and wins that virtual service delivery provides, and how to get through the challenges as well.
So the document that you guys will have seen and reviewed, the Practical Guide for Virtual Service Delivery, was developed to kind of address this emerging need. Several months into the pandemic, there was a need that was seen that we need to kind of have some kind of best practices documents or some kind of documentation about this. So I was brought into the project mid-2020, and I saw it as a great opportunity to build on some of the emergency response work that I had done earlier in the year. During the initial lockdown in 2020, I helped build a COVID support tracking database. So I had like a very small window into how organizations had been affected by the pandemic. So getting to work on this research brief gave me an opportunity to look really closely at how exactly organizations were affected and what they needed to do to kind of continue delivering services. One of the challenges with this project was to try and collect, catalog, and synthesize an incredibly wide range of organizational service deliveries, different kinds of organizations, different kinds of best practices. And what I found was that there were some best practices that are very clear and very universal, that we can apply pretty much to anybody's service delivery. But others are very dependent on like the context of the organization, the population being served, or the software that's being used. So what this means is that not all best practices will be applicable to all organizations. So by this point in the pandemic, the vast majority of professionals, so like professionals with designations like social workers or registered nurses, doctors, psychologists, they'll have some form of best practice guidelines that have already been developed as a response to COVID-19. So if your organization employs, receives services from, or consults with professionals, like the ones I just listed, or anyone else that has kind of a professional accreditation, then the #1 best practice recommendation is to review the specific COVID recommendations for that specific industry. And they're universally now, almost every registered industry has some COVID guidelines that they offer for their practitioners. And there are some additional best practices, largely around the use of technology or certain platforms that all organizations delivering service virtually need to take into consideration. And you'll probably hear these a couple of times over the course of the presentation. But reviewing the best practices for your chosen platform, like the virtual platform that you use, from like the platform developer and from users, to ensure that clients have a positive experience. That's incredibly important. As well, reviewing the confidentiality and anonymity practices that you're using in this virtual space that might be different from how you would do it in person, is also incredibly important, because you need to ensure that clients have an accessible way to provide consent virtually, and ensuring that your online platform is secure so that that information is safe. So moving on to organizational concerns, talking about organizations broadly, and none of you will be surprised to hear this, but organizations in Calgary and throughout Alberta have had to respond to a lot of challenges, change, and uncertainty over the past several years. Not only have you had to respond to the pandemic recently, but with the sustained economic recession as well. Being able to effectively plan for and respond to emergencies and the ability to be flexible is more important now than ever, especially if you provide services to vulnerable populations that really need them. So when we think about organizational concerns during an emergency like COVID-19, we kind of have two general umbrellas that we need to think about. We need to think about business continuity and then industry-specific concerns. So business continuity will be a familiar term for almost all of you. It's the processes, practices, and plans that organizations develop in order to respond to emergencies or service interruptions. So things like, from my own work unit, having a muster point, floor wardens, emergency protocols are all typical business continuity practices in normal times. And you might even think of drills that you would have run in your own office back before COVID. Most, if not all, FCSS-funded organizations have some form of business continuity planning. However, the COVID pandemic presents a really unique challenge to business continuity practices because both its infectious nature and the prolonged duration of service interruption that it requires. So it's important to review all of our best practice or our business continuity practices to make sure that they're relevant for the current emergency and keep workers and clients safe. The first best practice is to identify what is most critical to service delivery. What does it actually take to keep your organization delivering service? What processes, organization, or operations or functions are critical to your organization? What internal or external dependencies are critical to your organization? So who or what depends on your organization functioning and would not be able to function if they didn't receive the benefits or the services you provide? And what else could affect your business as the emergency continues? So this is things like, what happens if we have staff shortages? Could revenue streams dry up? What does our funding structure look like now? Do we still have to pay rent on our building if we're not occupying it? So clearly understanding and identifying what is essential to delivering a particular service is paramount. After you've kind of identified these critical elements, what your business needs to keep functioning, then you can move towards building mitigation strategies and ways of responding to whatever the emerging crisis is. So once you understand what is essential, you can then mobilize a response. It's important to note that there are, as I said before, no one-size-fits-all solutions for business continuity, both between organizations and between crises, because a wildfire is very different than a pandemic. But no matter the emergency, you need to know exactly what is critical to your organization to keep delivering service so that you can figure out a way to keep delivering it. The second major pillar of organizational best practice and concern is to understand what industry-specific concerns your staff might have to be aware of. So organizations working in different industries with different clients, providing different services, will all have unique and specific concerns. One organization that employs registered counselors, while another might have medical staff like doctors and nurses. These organizations could have very different needs and professional development requirements, or professional requirements, I should say. So the things that the professional best practices that I was mentioning earlier, how that interacts with how they deliver service. Organizations that employ specialized staff need to review those industry-specific best practices to ensure that their staff can still deliver high-quality services, and you're not preventing them from doing that.
Great. So moving on to best practices in technology. So I'm going to start with sort of the greater use of technology during a pandemic. So one of the ways or the impact of the pandemic has been mitigated around the world has been through the use of technology. So our ability to adapt, be it working from home or using technology in new ways, has greatly reduced the spread of the disease and made it possible for some services to continue to be delivered. Now, the increased use of virtual platforms comes, of course, with its own set of risks, considerations, and best practices to ensure that the quality of service provided remains high and that the experience is provided, for clients is positive. When we look at quality of technology, so there is a large body of literature already on virtual platforms and how different industries and service providers can use them effectively. So one of the most important practices we've learned in doing this scan is that the quality of the audio video experience is critical for clients receiving virtual services. Now, if clients can't clearly see or hear you, their ability to receive the benefits of your work is greatly reduced. Now, this becomes even more important when you are delivering a sensitive or caring service or establishing a therapeutic relationship. So similarly, the ability for clients to navigate the online platform is extremely important for their experience during service delivery. Various platforms, so sort of best practices when we're using various platforms. So it almost seems like every day we have new virtual software or a platform or a tool we need to use to connect and do our work. So between Zoom, Microsoft Teams, there's Doxy, Skype, Google Hangouts, Roundtree, you name it, we are expected to have mastery over these platforms to serve our clients. Now, determining the best platform can be difficult, and best practice recommendations across the literature is to use a platform that is intuitive in nature and simple enough for your clients to use, including yourself as staff. Let's talk about Zoom fatigue and other mental health related concerns. So a new phenomenon that is being researched is the draining effect that meeting virtually seems to have on staff and clients. So this is otherwise referred to as Zoom fatigue. So Zoom fatigue seems to result from the difficulties our brains have being virtually connected while being socially distanced. So this is an impact to be mitigated, not avoided. Zoom fatigue reminds us all about the best practices for desk work. So, getting up and walking around, stretching, working from an ergonomic workspace, you name it. Now, Zoom fatigue may pose challenges to the way we work now, but best practices, or the best practices we knew prior to the pandemic, still take effect in this new virtual environment.
All right, so we're going to now define some of these different virtual service delivery types. So when I started conducting this review, it became necessary to create different categories to describe the similarities and differences that I saw in the literature. So I categorized the literature into three types of virtual service delivery: virtual counseling services, virtual mental health services, and then virtual health services. So virtual service delivery, simply put, is what most of you have been doing for a year now, providing services, support, and connection virtually instead of in person. Virtual counseling services cover many services from life coaching to complex care plans, but these services employ professionals that address challenges in people's lives that generally don't rise to the level of a mental health or physical health intervention or diagnosis. So these services generally deal with less severe issues than, diagnosable mental health or physical health issues or diagnoses. So then virtual mental health services are then the ones that have that diagnostic ability. They're vitally important, especially during the pandemic. We all know the effect that the pandemic has had on kind of the world's collective mental health. And these professionals provide very specific services addressing specific challenging client issues that may or may not have a previous mental health diagnosis. So mental health services that are provided virtually have specific organizational and best practices related to, oh, this is my cat, everybody. Sorry about that. Mental health services virtually, they have specific organizational and professional best practices to deal with specific mental health diagnoses. And then virtual health services is an increasingly popular model for service delivery around the world. Virtual health services are provided by licensed medical staff, so RNs, LPNs, MDs, etc. And these services are what we understand, normally as going to the doctor. They can encompass most health concerns from injury to mental health or addiction stuff. And we'll talk about that a bit more later. Virtual counseling services. So let's talk about these for a few minutes. The literature surrounding virtual counseling service delivery is extremely wide-ranging and covers dozens of different professionals and service delivery types. As I mentioned before, life coaches, counselors, psychologists, different kinds of therapists, different counselors. These can all provide virtual counseling services. Our best practice recommendations for providing virtual and counseling services are as follows. So as we mentioned in our technology overview, providing a high quality virtual environment for clients is paramount. This means having good quality software that you understand how to use, having a good audio visual equipment, so having high quality cameras and microphones, so clients can see and hear you in following whatever the recommended best practices are for delivering that kind of service and for using that platform. We highly recommend as well that organizations providing virtual counseling services review the webinar presentation, and this is linked in the service delivery guide, as are all these resources. But caring at a distance, online counseling best practices during COVID-19, I believe that was developed by PolicyWise. It is a foundational resource collecting industry-specific best practices and provides excellent advice for organizations on how to start delivering these services virtually and how to do so effectively.
Right, so best practices, so just around virtual mental health services. So as mentioned previously, virtual mental health services are vitally important, especially during the pandemic. Now, the organizations that provide these services usually employ a registered psychiatrist or other certified professional who is licensed to provide these specialized client services. Now, Alberta Health Services identifies mental health services as serving individuals and families who are suffering from a diagnosable mental illness, such as, but not limited to, depression, there's postpartum depression, anxiety, obsessive compulsive disorder, schizophrenia, and trauma. Now, virtual mental health services are different than virtual counseling services in that a practitioner is often a professional who is licensed to provide mental health services, prescribe medications, and has sort of that diagnostic lens. Now, this diagnostic lens is the major difference between counseling service delivery. Now, when we look at the benefits of virtual mental health services, so the benefits of these services are very clear and they're well researched. Now, providing mental health services when provided well is just as effective as in-person services. Now, another benefit is that it can help fill in gaps for clients who might not otherwise be able to access mental health or other services. Now, if you go look back to the guide, sort of our best practice recommendations are as follows. So provide a high quality audio video environment for clients. So this means following software best practices and making sure you are being seen and heard clearly. Review the resource toolkit, so e-mental health implementation. So this is an excellent tool guiding organizations on transitioning to an e-mental health model. It contains best practices, there's planning exercise and specific guidance on what this specific type of service delivery entails.
I'm also going to just jump in, shameless promotion, but the e-mental health implementation guide was developed by, in partnership with the IWK, which is a children's hospital in Halifax, where I'm from. So I definitely included that because of that little home connection for me. Moving on, virtual health services. This was one of the ways that I started getting into the literature, was looking at all these virtual health platforms. So some organizations may employ medical professionals to provide medical care or treatments for clients or consultations. Virtual health services have been growing in popularity around the world for actually the last 10 to 15 years. A lot of the literature that I saw was based in the UK. There's been a large uptick for the last 15 or so years using telehealth there. As well, I was just speaking to a colleague the other day who told me about work that she did in Nigeria, where there was a rural communities being connected for maternal care with virtual like doctors and nurses. So really interesting stuff. Lots of really cool research going on there. So yeah, these virtual health services facilitate connecting professionals with people who might be living in like remote communities or who are unable to visit a doctor in person for some reason. So for organizations who are already providing virtual health services, or who were providing health services prior to the pandemic, the transition to online-only service provision might not be as drastic or dramatic as it might have seemed. They already have processes and procedures in place to help accommodate this. But for many organizations who offered in-person medical services, adopting this model for this new model for the first time presents a lot of new challenges. So while there is a lot of established best practices and literature, taking it on for the first time might seem daunting. The benefits of virtual health services, are apparent, but are very interesting. They allow medical professionals to access vulnerable clients who might not be able to travel safely, or might not have even a way of getting to a doctor's office. So this increases reach and access. It keeps medical professionals in our current pandemic and clients safe from transmitting COVID or other communicable diseases, so it ensures client and staff safety. And many medical professionals already do this, either through the use of phone calls or telehealth, so the best practices are well established. So best practices, again, we need to review the specific best practices for the industry of medical care providers. So if you have nurses that you're employing or working with, you need to review the nursing best practices. Same thing for doctors, same thing for psychologists, and all of those exist now for those professional designations. And then again, reviewing the technological platform that you're using and making sure that you have that really high quality experience. In the literature that I saw from doctors and medical staff, they focused a lot on removing distractions in the background. They really were honing into, no light streaming in from a window, no distracting things in the background. See, I have my bookcase up here, which could be very distracting for somebody who is trying to have a therapeutic relationship with you. So keeping those things minimal becomes very important.
All right. So looking at other considerations, so sort of along the lines of age, gender, language, and other factors. So many of you work with organizations that provide services to vulnerable populations. So it's important to consider how COVID-19 and the pandemic may impact these populations differently and how these differences may interfere with service delivery. Now, organizations need to be keenly aware of the needs, limitations, and accommodations their clients need in order order to access services. So understanding what challenges a person or population may face is paramount to good service delivery. Now, the ways in which you communicate information with clients needs to be sensitive to their specific needs. So for example, if you are working with groups who have trouble navigating online platforms, they may have fine motor issues, challenges with vision and hearing, your service delivery needs to accommodate those challenges while still delivering high quality service. Now, there are specific best practices you can follow in considering the needs of vulnerable populations. So this includes, making sure you use large accessible font and clear graphics when sharing information. Another thing that I learned along the way is really paying attention to color. Some folks do have challenges just depending on how color is laid out on documentation. So important to keep that in mind. Providing information and instructions that are accessible to your population and easily understood. So, translation and interpretation services may be great. Looking at Braille, accessible fonts and graphics with specific meanings, etc. So doing your best to keep messages short, clear, and concise. Sometimes too much information can detract from your messaging, make things a little bit challenging for clients in that sense. All right, over to you, Brenden.
Yes, well, and Cynthia, that takes us to the end of our presentation. So I wanted to thank everyone very much for listening. We really appreciate the interest and are really happy that so many organizations are working so hard in Alberta to make sure that service delivery goes on despite the pandemic. So thank you. And now we would like to open it up for questions and answers. So please post questions, comments into the comment box. I'm a Zoom newbie, so I'm not entirely sure exactly how that works, but we'll figure it out. And Cynthia and I received a couple of questions prior to the presentation, so we are going to kind of address those first.
Okay. And also too, I know Brenden here and I are up here. We may seem like we're the experts on some of these guidelines, but we want to encourage some of you as participants as well. If you have some ideas, things that are working effectively for you, please feel free to include that in chat. So one of the first questions that we got, so this one person that wrote in is interested in hearing about best and promising practices around meaningful social connections in a virtual environment. So finding ways to connect isolated individuals and support people's social interactions and needs when getting together is not possible. So really what we would encourage, with this, the person who wrote this in and others, is to look to your service users and clients and sort of figuring out what makes sense when meeting in a virtual environment. I think sometimes we get so wrapped up with planning for services that we often forget to look towards the community, who I feel are experts in terms of how they want to see service provision.
Thanks, Cynthia. And the second question that we got was about what are some proven practices with regard to like advertising or communicating programming that results in attendance for virtual events or social programming. So I had a quick look last night at some of the virtual platforms that are out there and kind of what are some of the ways of promoting virtual platforms. There are now actual virtual spaces, like there are virtual fairs that you can go in and have an avatar that walks through virtual stands. So I think that there's some really interesting things using different kind of platforms that we could do that are now novel and interesting that would be really engaging. So the best practices for kind of advertising, communicating, and getting attendance at these virtual events is to create an engaging experience. So participant engagement is now more important than ever. I don't know if anyone has been in a 3-hour-long meeting, but it can get a little tiring being on camera and sitting and just staring at your computer for that long. So you have to be able to connect with viewers and hold their attention. So it's important to incorporate into your promotion and your actual event, like engagement. What are we going to be doing? What is the draw for me? So promoting things like breakout rooms, virtual networking sessions, games and little activities, things that are actually fun and interesting that kind of get people out of just sitting and listening to somebody talk at them through a screen. So yeah, actually incorporating things that as much we can that were fun from in-person events into virtual events kind of helps create that engagement. As well, context is incredibly important when you're promoting these events, because it's really easy to tune out if you're not feeling engaged or you don't really understand why you're hearing what you're hearing. So making sure that you promote and provide a lot of context and understanding so that people really kind of connect with why they're there and what they're getting out of the session. And then kind of touching on the platform thing that I mentioned before, but using reliable and engaging technology is very important. So now there are a bevy of very interesting and engaging and novel online platforms that we can use for these events and for different kinds of engagement. And these technologies, we have to make sure that they're reliable and we have mastery over them, as we know from our best practices. But using novel technology right now is kind of something that we should be taking advantage of.
Great. Thanks, Brenden. I'm looking at some of the wonderful comments, feedback that's coming in. Many of the participants have shared some of their own best practices. And so I do want to capture the one. So there's one from Sharon Nixon. And so just the importance of having closed captioning. So of course, when we're meeting in these spaces, webinars, we're meeting online. So just making sure we have closed captioning for individuals who are hard of hearing. And then, if anything, making sure that we have an ASL interpreter. So Liza Chan has made a comment around the challenges. So just being unable to access a digital device, but being unable to pay for the internet. And so I know we saw quite a bit of this in Calgary, where we assume like no problem, like an issue with the pandemic and access to technology is to give people devices. But then, we forgot the fact that these folks need to have internet, or at least a plan in place in order to use those devices. So I know we had a few of the telecom industries that were providing discounts or waiving fees for community members, which is really great. So hopefully that's something that we will consider as part of our planning in the future. What else? I'm just trying to see what else we see in the comments. Yeah, so access to technology and internet. So that seems to be a popular one. Yeah, so it's coming up again. So that's a popular one. So hopefully, at some point, for those of us that are working with organization, maybe that's a conversation we can open up, further explore and brainstorm how we can service the needs of the community.
There's an interesting comment I see here about seniors and access to technology and the ability to use technology. I can just share some of my experience. I worked with the Indigenous Relations Office recently on some engagement, and it's engagement with elders. So socially distanced, physically isolated elders in all across Alberta. And what United Way did with them was they actually did programming with their seniors. It took time. They had to, because these were ongoing engagements, they had to teach their seniors basically how to use the platforms. And once that was done, actually, they were very successful at using them, but it did take some time. So one of the ways I've seen that mitigated is to actually do some dedicated programming with seniors just to help them get over that hump.
Yeah. Yeah, there's one comment around so data collection. So we're seeing this all across the board with organizations. Organizations are having to get creative with how they collect their data. So whether it's spending additional time over the phone, or finding ways to get that information or collect that information from clients. So I know sort of the message we've been giving organizations is to do your best. We know it is pretty challenging, but I think it's also inspiring as well to just see some of the innovative ways that organizations have had to collect that data. So I think that's really great to see during these times.
I love that cyber seniors comment. That's great. Like developing a program to kind of help mitigate some of these things that we know are going to be an issue. people are going to have trouble with their phones or their technology. So we're going to build a small program to try and mitigate that risk or that challenge. I think that's really clever.
Yeah. And then we have a comment from Karen Whiteman, so who was saying that low-income seniors can now access low-cost internet. And Karen, sorry, I don't know if you're in Calgary or if you're based elsewhere, but no, this is really helpful. I think just sort of keeping a pulse of what services are out there in the community. I know the Calgary Public Library has actually provided loaner devices to the community. So if you have a library card, you can actually borrow a device, which is really great. It makes it easier. Yeah, if you have any other ideas, suggestions, tips that's working for your organization, please continue to post them in chat. This is really great.
Yeah, that comment about the surveys with the youth, yep, that's exactly right. Yeah, you built in like mitigation strategies to help them just kind of get through that. I think that's really, really what we need to kind of be doing for some of these issues.
So I'm just, it's that technology and internet that's top of mind for a lot of organizations.
Mm-hmm. And Cynthia, that was I liked your point about the not just access to the devices, but access, like structural access to internet itself. Yeah, when I was involved in getting some of those resources to people during the pandemic, yeah, we were sending around a lot of devices and things like that to people who had internet. But of course, if you don't have internet or you can't afford it that month or whatever, then the device is useless to you. So bridging that gap becomes even more important as well. And I like that. Let's see.
Yeah, and I had there's one of the organizations that I work with in Calgary. I think the one thing that we sort of took for granted is when we were meeting in person. So with a lot of the in-person programs, kids would come, they had access to snacks, and for some of the kids that come from low-income families, food obviously is a challenge. But when the pandemic hit and we moved to virtual programs, a lot of these kids didn't have access to those snacks and programs. So we had organizations that got creative, and so they were sending activity kits home, and then just putting like a small snack in there for the kids. So just that way they can continue with programming in a sense as they would in person, which I thought was really unique and creative.
I see here someone, Anna's asking about getting the document or the link for virtual counseling. We will work with the FCSSAA to disseminate that, to make sure everybody has a copy of it. And all the links are in there. So like the link to that virtual counseling services webinar and the other resources will be in there, all accessible. So we'll make sure everybody gets that after this.
And then maybe what we'll do, it just seems like with some of the suggestions that were shared by organizations, maybe we'll see if we can connect with some of you if you feel comfortable in sharing just additional resources. We can maybe just collect that and we can also send that out. So we'll certainly send out the presentation, the virtual service delivery guide for those of you who haven't gotten a chance to take a look at that, just so you have access to all of that. Okay. Yeah, I'm just looking. Are there any final questions? Looks like I think we're good. We got most things covered. Yeah, and there's additional resources coming in, and we'll compile all of that. All right, so it looks like that is it as far as the presentation goes. Really great conversation happening in chat. Thank you everyone for that.
Great, thank you, Cynthia and Brenden. That was really, really informative presentation. And again, we will send out the slides and the recording to everyone, and any links that you send us, we'll send that out. Now, our usual distribution list is to our FCSS member programs, but I think there are a lot of organizations who probably aren't on that list. So I'll make sure that we also send it out to the Zoom list. So if some FCSS programs, you may get a duplicate email, I apologize for that, but we'll try and do our best. Thank you, everyone. Have an amazing day and take care.
Thanks, everyone.
Bye.
Great. Bye. Thanks, everyone.